Safari Africa, from the heart of the world.
Previously on our series on mental health care in Kenya.
The drug addict children, their problem, want to believe parents. Parents want to keep their children indoors. They don't want to expose them out. Mombasa is almost 75% drug addict zone.
Just like any other citizen, persons with mental illness are also entitled to an insurance cover, though subject to laws relating to competence in terms of entering into contracts. The Mental Healthcare Act makes it a criminal offense for any insurance company to exclude or restrict treatment for mental illness within its insurance policies. According to Section 46 of the Act, 1. Every person in Kenya shall be entitled, if he so wishes, to insurance providing for his treatment as a person suffering from mental disorder. And 2. An insurance company which makes any insurance policy which expressly excludes or puts restrictions on the treatment of any person suffering from mental disorder shall be guilty of an offense.
Right now we don't have a policy on mental health, so that's one of the challenges that in terms of implementation of even mental health issues, the lack of a policy itself, because the policy is the one that derives the programs and the projects and activities for the implementation of the act.
So it's the act that has been there for 10 years.
The Mental Health Act is in place. So to operationalize the act even more conveniently and in a more appropriate way, we have the policy. The policy is more like the government paper on how they're going to implement their projects. And therefore, we have the act, but we don't have a policy. We have a general policy on health, but then we need a specific policy that caters for the specific needs of mental health. The current Mental Health Act was put in place in 1989. It came into operation in 1991. And that's the act that we've been using for quite a while. Of course, it's been overtaken by events, considering that now we have the United Nations Convention on the Rights of People with Disabilities. And disability, mental health is a disability, and therefore there is need to, and Kenya is a signatory. It has ratified that instrument. And therefore, there is need to put it in line with that international covenant. We had the new constitution in 2010, which provides for progressive measures, particularly on matters of health. And therefore, looking at Article 43 on economic and social rights. And therefore, there is need to align all our, in the implementation phase of the Constitution, there is need to align all our laws, especially those that are existing at the moment, so that they be in line with the Constitution, so that then we are in a position to realize the benefits of the new Constitution.
Okay. Yeah. So, the question begs, if there is already an established law regarding the administration and governance of mental health care issues in this country, why then does there seem to be such a glaring gap? Why is there a persistent perception that mental health care patients have all but been forgotten? Dr. Kalia has his thoughts on this.
For me, it's a question of a lack of priority. It zeroes into issues of lack of seriousness, and at some point even to a level of ignorance. And I'll give a case example. The reason why you would visit a government hospital and find that attending cases of malaria, you realize that it's not given serious consideration. So imagining that cases of mental health would be given consideration would be far-fetched. If a case of malaria, which is so common, is not taken serious, then what about a case of mental health?
Civil society activist and champion of mentally disabled children, Caleb Mulwa, also had his opinion on this matter.
The problem with Kenyans, and especially every Kenyan, is that we follow policies, protocol, service charter, and all that stuff. So now, for example, if you go to a certain company, according to our protocol, according to our policies, according to our service charter, and in most cases, even those things, they have been pinned behind the reception.
So, what is the way forward?
The way forward is for Kenya to open their eyes very wide. Mental health, you cannot wish it away. It is like an epidemic. We need to open our eyes and recognize, one, it is there. Two, we need to realize that in every situation, we have the resources to intervene. Kenya has the resources. We are professional people out there who actually are very willing to go the extra mile to create a national think tank of people who understand mental health, not mental illness necessarily, to sit together, and the government can tell them, we are putting you in this location for the next 2 weeks. Can you think through and come up with a proposal on what we need to do in this nation? And then these people will look at all facets of life in Kenya. They look at the farmer, they look at the rural guy, they look at the urban person, they look at the businessman, they look at the prisons. We need to have a think tank looking at all these aspects and recommending to the government this is the way forward.
And that concludes this series on mental health care in Kenya. We have focused on Nairobi and Mombasa and have compared statistics, experiences, and unique challenges as being experienced within these two unique areas. If you feel you may be having some features of possible mental unwellness, please do not hesitate to ask for help, talk to someone you trust about it, or seek assistance at your nearest medical or counseling facility. On behalf of my producer, the staff and management of Safari Africa Radio, I would like to sincerely thank you, our listener, for keeping it Safari Africa. And remember, as aptly phrased by the Kenya Psychiatric Association, there is no health without mental health.
Safari Africa, from the heart of the world.